our next speaker is the wonderful Dr. Michal Kahn from Tel Aviv University in Israel. Dr. Kahn is going to discuss the results of a very hot off the press study that we published together with Professor Emily Oster from Brown University in the Journal of Pediatrics. And Michal's talk is titled How Auto-videosomnography Led to Discoveries About the Impact of Teething on Infant Sleep. All right, thanks, Michal.
Thank you, Natalie. Can everybody see my presentation and hear me all right? Wonderful. All right, so thank you. I'm so happy to be here, and thank you for the fascinating talks so far, so important and interesting. And I'd like to talk to you about findings from our study on how we used this amazing auto-videosomnography tool to investigate the link between teething and infant sleep. So the belief that teething disrupts infant sleep is incredibly widespread. What you can see here in these examples that I put on is how this topic sparks really countless online searches and blog posts and conversations in pediatricians' offices, and advice on managing the havoc that teething supposedly wreaks on sleep is just about everywhere. But we were kind of curious and wanted to understand whether teething really disrupts infant sleep, or could this be more of a kind of a myth that's been going on for years and years rather than a reality? So let's take a bit of a look at the scientific evidence. So we know that infant sleep gradually consolidates and evolves throughout the first year of life, and this coincides with the period when primary teeth typically emerge. So the first tooth eruption typically occurs between the ages of 4 to 10 months, and by around 30 months of age, most children have all their 20 primary teeth in place. And previous studies have shown that both healthcare professionals and parents really strongly believe in the connection between teething and sleep disruption. In fact, one study found that 81% of Jordanian parents believe that teething causes sleep disturbance, but actually we have studies in the States as well as Brazil and Australia and Poland and other countries showing very similar high rates of the endorsement of this belief. However, most of these survey studies that have asked this question have asked parents about these effects well after they've occurred. So they've been retrospective studies, and all of the studies that we know of have relied solely on parent reports of infant sleep, which we know could be impacted by several biases, mainly recall biases, especially when it comes to events that happen at night. So acknowledging the importance of objective assessment of sleep, we aim to understand whether teething is associated with objectively measured infant sleep. And to address this question, we recruited parents of 849 infants aged 3 to 18 months from the US and Canada, all of whom reported a tooth eruption within the past 4 weeks, so it had to be pretty recent. And what enabled us to use objective sleep metrics from such a large sample was, of course, our collaboration with Nanit and our use of auto-videosomnography. So you've heard about this, and you'll probably hear more about this exciting methodology from all the speakers today. So I'll just briefly mention what I see as the amazing advantages of this technology. Based on computer vision, what we get is validated automated nightly sleep data, and this is from analyzing the motion stillness patterns of the infant within the crib. So it's kind of like actigraphy in how the algorithm translate motion stillness into sleep metrics. And part of the key advantages is, of course, that it allows for naturalistic, non-intrusive assessment on a very large scale. And as Tom asked before, it's very easy to collect and collaborate. So this was a fun study to do. So for this study, we collected the objective sleep metrics for 4 weeks. We had 3 weeks leading up to the tooth eruption, and then 1 week following the tooth eruption. And in addition, parents completed an online survey.
This is a study of
that
teething
asked about
causes
their
sleep
infant tooth
disruption,
eruption, including.
which is really interesting, right? Because all parents
So
all
should
think
we-
Judy,
that
you
it
may
does,
want to just
but-
mute. Sorry.
Oh.
Sorry, Judy.
Okay, thank you. So as I was saying, parents also completed a survey about the tooth eruption. We asked for some details on the location of the tooth that erupted, what the symptoms were, how parents managed these symptoms. So that gave us both the objective and the subjective perspective. And here's what we found. So looking at these graphs, what you see here are the sleep patterns across the entire monitoring period. So we have the almost 1 month of recording, and the red boxes indicate the teething period. So we have 1 day before to 1 day after the reported tooth eruption. And as can clearly be seen, and was also corroborated by our inferential GEE analyses, there were no significant differences in any of our sleep metrics between teething and non-teething periods. So total sleep duration, number of nighttime awakenings, and parent visits to the crib all remained pretty stable without any significant differences throughout the assessment period. We don't have time, so I won't show you. We also analyzed this using change point analysis, and similarly, those analyses showed no association between teething and between teething and objective sleep metrics. What was interesting, though, and perhaps not surprising given what we know from previous studies, was that parents' perceptions told a different story. So 51% of parents in this sample reported noticing changes in their child's sleep during teething. And of these, 87% reported more nighttime awakenings, and 55% reported less sleep, and 39% said that bedtime became more difficult. And a lot of these parents also used management strategies to help their kids with teething symptoms that they perceived. And as you can see here, there was quite a bit of pain medication use. So 56% of parents used analgesics, and also we had 14% using local anesthetics, 13% using different homeopathic remedies. So quite a lot of ways that parents try to use to ameliorate, to help their children with these symptoms. So although over half of the parents reported these disturbances during teething, these sleep disturbances, these were not corroborated by the objective data. And this lack of objective evidence for this link that might be a little bit of a myth aligns actually with 2 prospective studies that didn't find evidence for this link as well. So these were studies conducted about 15 years ago, and they actually used sleep diaries to ask day by day, to track infant sleep day by day prospectively, and those didn't find any associations either. Still, the discrepancy between objective data and parent reports in this context is in itself really interesting, we thought, and we know about these discrepancies. We've seen them in quite a lot of actigraphy studies. And I just wanted to kind of put a few explanations or possible ways to understand this discrepancy. So first, it might reflect recall bias. So parents may not be aware of every awakening, and they may not remember all of the things that occur during the night. There might also be confirmation bias at play. So if you expect that teething will hinder your baby's sleep, that might bias your attention towards their distress signals and lead you to attribute signs of distress or crying to teething pain. And at the same time, it's also possible that these different methods capture different aspects of infant sleep. So while the number of awakenings may not increase on teething versus non-teething nights, infants may be more likely to cry more intensely or be more distressed when they wake up. And what might be captured more strongly by parent reports rather than our objective data. So I think that's another reason to kind of that stresses the importance of collecting both objective and the parent kind of point of view, that to provide a comprehensive account of these relationships. So our findings have important clinical implications. I think they seriously question the taken for granted link between teething and sleep disruption, and suggest that we might need to reconsider the routine use of medications for teething-related sleep issues, and maybe inform parents and clinicians that teething doesn't necessarily impact sleep, to kind of adjust their expectations and question that taken for granted relationship. And of course, in case there's a persistent sleep problem that's masked as teething, targeted sleep interventions should be considered. And I think that's an important kind of take-home message from this. In terms of the strengths of our study, it used objective sleep assessment, it used a large sample, and we had a longitudinal design. So we had 4 weeks of measurement, but of course, it also had its limitations. We couldn't capture objective sleep outside the crib. Tooth eruptions also were not retrospectively reported, so they were retrospectively reported. We didn't catch them in real time. Parents reported them within the month before the survey was the data was collected, and the sample was quite privileged, which may limit its generalizability. And of course, these could be addressed in future studies using multi-method sleep assessment within more diverse populations and with prospective tooth emergence kind of diary tracking to further assess these links. We could do that in the future, but for now, I'd really like to thank my amazing research partners. You can see these amazing ladies here, and I want to thank you so much for your attention.
Amazing. Thank you, Michal.
Thank you.
All right, great. We had a lot of fun doing that study. But there were, as you recognize, there were certainly some limitations. But what I would love to ask you is, in future studies, what are some of the, additional variables you would want to collect to better understand the differences between those parent perceptions and the auto-videosomnography data?
That's a great question. So I think one of the things that would be really important to collect would be what parents actually do. So here we ask them how they manage symptoms in a kind of a general way, more broadly. I think what would be fascinating would to take that into account on a day-to-day prospective basis. So to ask them what happened tonight and what did you do about it? Because there are so many strategies out there, and those strategies have their risks, and they might also improve sleep. So we couldn't really take that into account in our analyses, and I think that could be a great next step to kind of have a more fine-tuned and higher resolution assessment of that aspect.
Yep. Love it. Okay, thank you. All right, and again,
Sorry, may I ask you,
yes,
is this study published or?
it is.
It's actually,
Yes.
oh, sorry,
Michal, you go.
Okay, thank
I
you.
was just saying that it's just in press. It's online. It's in the kind of last stages of proofing, and yeah, I'll be able to share. We'll be able to share it really, really soon.
Thank you.